Welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I would like to discuss the concepts of weakness and inhibition. True weakness occurs when there's an injury to a motor neuron or disuse atrophy. A muscle receives a signal to contract and generate force from the nervous system through a motor neuron or nerve. When that motor neuron is injured, it can reduce or eliminate the ability of that muscle to contract and generate force. Disuse atrophy occurs when a muscle becomes physically smaller, and due to its decreased cross-sectional diameter, it cannot generate as much force as it could when it had a larger cross-sectional diameter. Without one of these two mechanisms present, it is more likely that you were experiencing inhibition and not weakness. To inhibit means to reduce or prevent. So when a muscle is inhibited, that means its ability to contract and generate force is being reduced or prevented by a reflex mechanism or other inhibiting factor. Now, we often mistake inhibition for weakness, which can reduce the effectiveness of a rehabilitation program or your training program and your performance. There are several factors that can lead to inhibition of a muscle or muscle group, but we are going to focus on reflex mechanisms, reciprocal and autogenic inhibition. Reciprocal inhibition occurs when a muscle contracts, has excessive tone or is tight, or has myofascial trigger points. The muscle that is in a state of contraction causes the nervous system to inhibit its antagonist, which is the muscle that does the opposite movement, or its synergist, which is a muscle that helps the inhibited muscle to perform its movement. Autogenic inhibition occurs when the Golgi tendon organ in a muscle tendon is activated and it inhibits itself to prevent injury. Autogenic inhibition can also occur when a muscle has myofascial trigger points. So if you've ever noticed a decrease in strength, speed, and or coordination between training sessions without a mechanism of injury, again, it is more likely that you are experiencing inhibition and not weakness. It is very difficult to activate and integrate an inhibited muscle or muscle group into dynamic movement without first removing the inhibiting factors. So if you identify and remove the inhibiting factors, it will increase the effectiveness of your rehabilitation program or your training program and your performance. This is the reason self-myofascial release, ischemic compression, and muscle energy techniques are an important part of your recovery process.